Okay, Dr. Longmuir.
Let me go ahead.
Yes, please. Feel free.
So thank you everyone for the invitation to speak to you tonight about physical activity and play for children with cancer. I am a senior scientist at the Children's Hospital of Eastern Ontario in Ottawa and a professor in the Faculty of Medicine at the University of Ottawa. But my background is in kinesiology or exercise science at the undergrad and graduate level. I'm not a medical doctor, but focused entirely, my research program focuses entirely on physical activity and healthy lifestyles and quality of life for children with medical conditions and a variety of medical conditions. So what do we know about physical activity and children who either are in treatment for cancer or who have survived cancer treatment? The research tells us that they typically have decreased levels of physical fitness, both when they are in treatment and as survivors. There is research showing that exercise training programs can improve the level of physical fitness in adult cancer patients, but the evidence for children is very limited. Not a lot of studies have been done, and the studies that have been done are almost exclusively in children with acute lymphoblastic leukemia. So in that patient group, exercise training does provide benefits. It improves their body composition, their flexibility, their cardiorespiratory or aerobic fitness or endurance, their muscular strength, and their health-related quality of life. In the studies that have been done to date, it doesn't seem to help with fatigue, and it doesn't seem to change their daily physical activity levels. And as I said, we really don't have data for other cancer groups among pediatric patients. So there's a real need for more research in this area. So we also, researchers have also looked at what helps kids with cancer to participate in physical activity and what are the barriers that they report. And so the facilitators or the things that help are support from others, whether that's support from their treatment team or support from their parents and family members, support from friends, support from coaches and teachers. It also helps if they perceive physical activity as being beneficial for their health, they seem to be more active. And if they understand how they can use physical activity to cope with their diagnosis or their course of treatment side effects and stuff, that seems to help them participate in physical activity as well. The common barriers, the most common barrier that they report are a lack of knowledge about appropriate physical activity or what physical activity they should be doing or not doing, or misconceptions about physical activity and whether they can be active and play actively during treatment or as survivors. Fatigue obviously is a huge barrier for kids with cancer, particularly in the treatment phase, but even among survivors, it can be an ongoing issue. And then the authors of this paper also reported barriers related to psychological factors. So they grouped together things like a lack of motivation for physical activity, a lack of self-discipline to be active every day, feeling self-conscious about being active in front of peers, particularly if there's body differences from resulting from treatment. And so the guidelines for children's healthy physical activity, I thought I would kind of go through these because they apply to children with cancer as well as other children. And in Canada, we have guidelines not only for physical activity, but for the movement over a 24-hour day. And so the research has clearly shown that even if you go to soccer practice for an hour in the evening, if what you do the rest of the other 23 hours a day also has an impact on your health. So you really need to look globally at what your movement looks like over the whole 24-hour day. The graphic is made into a 4. because there's 4 different aspects to children's movement that the guidelines refer to, and these guidelines are for children from 5 to 17 years. I'll talk a little bit later about guidelines for younger kids, and there are guidelines for adults and older adults, but I'm not going to talk about those tonight. So the first section under of the 4 guidelines is what they call sweat guidelines. And I don't really like this title because you don't really have to sweat in order to meet this guideline. But what they're trying to convey is that these are activities that make you breathe harder or make your heart rate go faster. Sometimes you'll sweat. Younger children generally don't sweat, even though they are exercising fairly vigorously. And so for children and teens, it's recommended that they get at least 60 minutes a day of moderate or vigorous intensity physical activity. And that vigorous activities and muscle and bone strengthening activity should be sprinkled in there at least 3 days a week. Now, people think, oh, 60 minutes, that's a lot. But it can be accumulated in little bouts. So even 5 minutes at a time has significant health benefits. So you don't have to do the kids don't have to do the whole 60 minutes a day in one fell swoop. So typically the activities that would fall into the sweat category are things like soccer and swimming or basketball, snowboarding and skiing in the winter, that kind of thing. Riding your bike, and obviously going out for a run, but kids generally don't do that. That's more of an adult thing often. But for kids with cancer, and particularly kids who are in active treatment, we need to think about other activities that they may find get their heart rate up and get their breathing up, even though for their friends that may not be the case. So because of the fatigue factor, children may, when they're in treatment, may find just pushing themselves on a swing gets their heart rate up and get some breathing faster, playing with a bubble wand or flying a kite, fishing, some of the activities that are pictured here, which you won't see in guidelines if you Google on the internet for children's physical activity. You won't see things like that as being recommended. But for these particular kids, depending on their current status, that may actually be vigorous enough to get their heart rate and breathing up so that they are meeting that quote unquote sweat guideline. A good way to tell whether you're in the sweat range for the 60 minutes a day is whether you can talk. So if you can be as active as possible, but still able to easily carry on a conversation. So not when you're panting and out of breath and it's hard to get the words out. But if you're able to carry on a conversation and talk the way I am now, but you're doing as much physical activity as you can while still being able to talk, then you know that you're in this sweat range. So a lot of people think they have to get like really tired and really out of breath for this to count towards the 60 minutes, but that's not the case. The talk test works for adults as well as kids. The second piece of the guidelines is called STEP, and it's basically light physical activity. So light physical activity doesn't get your heart rate and breathing up, but you are moving around, you're not sitting still. And it's recommended that children and teens get several hours of a variety of structured and unstructured light physical activity per each day, whether that's walking to school or walking between classes for teenagers at school, hanging out with their friends at lunchtime or at the mall. There's drama classes, putting on shows, hanging out in the pool, going for a walk, paddling a canoe, doing yoga, and dancing. Dancing can also be vigor in the sweat category, depending on how hard you work at it, but it's also a good option for kids to just get moving around and not be sitting still. The third section of the guidelines is about sleep. And this is something that a lot of families don't think about as part of their child's movement every day, but kids and teens need a long stretch of uninterrupted sleep, and I know that can be challenging for some children undergoing treatment. So I just because those are the guidelines, don't think it's necessarily easy to get there for any of these guidelines, but so children who aren't yet teens, 5 to 13, need 9 to 11 hours of sleep per night, and teenagers 8 to 10 hours per night. And most consistently, consistent bed and wake up times. So going to bed and waking up every day at the same time or within a very short period of time really helps. Other things to develop good sleep habits are using your bed only for sleeping, no smartphones, TV, or electronics in the bedroom. If kids can leave their smartphone in another room of the house when they go to bed, the research shows that their sleep improves dramatically just because they don't have it pinging as messages come in at night. The guidelines actually recommend no smartphones or screens for 1 hour before they go to bed, which would be the ideal scenario, but at least not have them in the bedroom. Minimize light and sound and make sure that they can be comfortable both from a position perspective and from a temperature perspective. And then the fourth piece of the guidelines is the sit guidelines. And this is the smallest part of the graphic because it's supposed to be the smallest amount of time in your healthy, active day. So for children and teens, it's recommended that they have no more than 2 hours per day of recreational screen time. So recreational screen time does not include when they're using computers at school or when they're doing homework and searching for things online. So this 2 hours per day does not include anything where they have to use technology. It's strictly when they're scrolling through TikTok videos or playing video games, et cetera, et cetera. It's also recommended that they limit sitting for extended periods. And so having timers set on their phone or on the computer so that every 20 minutes or so you get up and walk around for a few minutes can really it doesn't sound like much, but it can really make a big difference in terms of the health impacts. So the guidelines, most of the research available is based on screen time, not necessarily sedentary behavior. And as I said, that's computers, it's TVs, it's phones, tablets, all kinds of different screens. But when we're talking about limiting sedentary behavior or the SIT guidelines, what we're not talking about is non-screen sedentary time. So everybody needs time to just relax and chill out. And so encouraging non-screen behaviors, doing jigsaw puzzles or painting or drawing or reading, playing board games, any of those activities that allow kids a chance to rest and relax, but also get them away from a screen are good to encourage. So I mentioned earlier, I talk a little bit about younger kids. And so younger kids, they have the same 4 graphic, although it only has 3 parts. So, but that's the way the graphic artists set it up. So for preschoolers, so this is kind of the 3-4-year-old age range, the recommendation is 180 minutes or 3 hours of physical activity per day of any intensity. So that's light, moderate, vigorous, everything combined. They should total up to 3 hours in a day. And again, it doesn't have to be 3 hours in a big block. It can be 5 minutes here and 10 minutes there, or what have you. But and it's actually better if it's spread throughout the day than if it's all in one block. They do say that they recommend at least 60 minutes, so at least one of the 3 hours should be fairly energetic play. Again, the sleep time is 10 to 13 hours in this age range with consistent bed and wake up times. And the SIT guidelines for this are less than 1 hour of screen time, which I find when I'm talking to families, this is the hardest thing for families to not accept, but to reconcile in their mind. They can the older kids 2 hours a day, they can sort of, they know their kids are doing way more than 2 hours a day, but they can sort of see that. But the idea that their 3 and 4 year olds should only have 1 hour a day is something that a lot of parents feel is really unrealistic. But there's very good research showing the detrimental effects of screen time at this age in terms of behavior and attention and all the things that they're trying to develop in order to be successful in school in the future. So again, encouraging reading and story time and trying to prevent kids from being restrained in car seats or strollers for more than an hour at a time. So if you are going on a long drive somewhere, try and build in some breaks where the kids can get out of their car seat and run around for a few minutes every hour, just so that they're not constantly restrained for a long period of time. The toddler guidelines are very similar. It's so this is kind of the 1.5 to 3 year old age group. So 180 minutes a day spread throughout the day, including energetic play, a little bit longer sleep time, 11 to 14 hours, consistent bed and wake up times, restrained for less than an hour at a time. But the key for the toddlers and the infants as well is no screen time. So there's very strong recommendations from our Canadian American Pediatric Societies and several other organizations that screen free until 3, so no screen time for infants and toddlers, but encouraging reading and story time and crafts and painting or finger painting or coloring or scribbling, whatever you want to call artwork at that age. Those types of things are all to be encouraged. And then the infant guidelines are interactive floor-based play spread throughout the day, at least 30 minutes a day of tummy time, 12 to 17 hours of sleep, including naps, and no screen time again, and restrained for less than an hour at a time. So this is also challenging for parents. Easy to do with very young infants who are not independently mobile because you don't have to restrain them at all. But once they learn to crawl or creep or bum scoot or walk, then the idea of only having them contained somewhere for an hour can be difficult with parents, getting home from work and trying to make dinner and get everything else done that they have to do in the day. So this can be a challenging guideline to meet. So those are kind of the recommendations that are general, as I said, for all children. The key is to interpret them relative to each individual child and where they're at in their cancer treatment journey, and to realize that those guidelines are the ultimate goal, not necessarily what everybody can realistically achieve. So the guidelines are based on what the research tells us give you the optimal movement behaviors that are associated with good health outcomes. But the research also very clearly tells us that you get the biggest health benefits by going from sedentary to a little bit of physical activity. And if you're already a very active child or teen or even adult, if you further increase your activity, the added health benefits you get are relatively small compared to getting the couch potato moving for even 5 or 10 minutes a day. So especially when they're in active treatment, the 60 minutes a day of moderate to vigorous physical activity may seem unattainable and maybe unattainable. But just every little, if you can even get 2 or 3 minutes total throughout the day compared to a day where you can't get any physical activity and that'll have very positive health benefits. So I wanted to also share with you some resources that we have for parents and families. And they were developed through a series of research projects that we actually did with parents of children who have heart problems. And so not exactly the same patient group, but since we did the project with the kids with heart problems, we've had a lot of feedback from families with kids with other medical conditions that they want access to the same resources, and they run into the same problems, and they need the same types of support and stuff. So I did want to share that study briefly with you. So this was what we did, was we interviewed patients and families, so kids and parents and young adults who were born with heart problems and had lived all their life with a heart problem, but were now adults. And then on the professional side, we talked to recreation professionals, cardiology, doctors and nurses, and mental health professionals, social workers and psychologists. And basically asked them, how do we promote healthy active lifestyles among kids? And what types of supports do you need? What type of resources do you need? What are the barriers you're running into? Et cetera, et cetera. And not surprisingly, what they told us was that each group that we talked to told us different things in terms of children's inactivity. So the families and kids told us that they wanted to be active and they knew it was important to be active. But when they tried to be active, they would go to swimming lessons, and the swimming instructor would be very hesitant or wouldn't let them participate, or their teacher at school wouldn't let them participate, or parents would tell us that they had been given guidelines from their doctor, but they weren't clear, and they didn't really understand exactly what they were supposed to do or not supposed to do. So therefore they were cautious in allowing certain types of physical activity. So that was what we heard from the patients and families. The recreation professionals told us that often they couldn't get information from the patients or families to know how they should incorporate children with medical conditions into the physical activity, that health professionals often couldn't tell, recognized they couldn't tell them specifics about a child in terms of privacy requirements, but they also felt that most health professionals didn't understand the background and education that recreation professionals often have. If they have a degree in physical education or recreation, then they have a lot of background in anatomy and physiology and learning styles and group dynamics and all kinds of different things that they didn't feel that medical professionals often recognized their training in their ability to deal with their patients. And then the health professionals told us that they tell all their parents to be, and all their patients to be physically active, but parents bubble wrap their kids, was basically what we heard from the healthcare professionals. So very different perspectives from each direction, but what that told us was that there was a real need for better communication between these three stakeholders that are involved in determining children's physical activity. Families also told us that they don't know what questions to ask about physical activity, or they don't think to ask about physical activity when they're in the appointment with the physician, because they want the test results and they need the medication changes and they need to report the symptoms, and there's so much else going on that they just don't think about physical activity until they often get out of the appointment, and then they think, oh darn, I was going to ask about such and such. So they wanted checklists or lists of questions that would be helpful to prompt them to ask about physical activity. The participants also, we were very surprised, the families really emphasized that they wanted the information about physical activity early. So the kids told us that they wanted to know things when they were young. Even the kids that we interviewed who were 4 and 5 years old had questions that they wanted to be able to ask and get answered about their physical activity. The teenagers told us that they wish they had learned more when they were younger to better understand what they could and couldn't do as they were growing up. And parents especially said that they didn't necessarily want it on the day of diagnosis because they would be too overwhelmed, but very shortly thereafter they would want that information right away, whereas often it came much later after treatment, or when kids were in recovery or post-treatment. Then the health professionals would get around to talking about them going back to sports or going back to school physical education classes. But the families actually wanted that information much earlier. And then of course the information needs to be individualized to each child and their diagnosis and their treatment status and their medical status and in terms of what they can do. And often a referral is helpful to a physical activity professional who knows that realm of physical activity, I guess. So at CHEO, we have a physical activity counseling service that's available to patients and families. Any clinician can refer patients and families to our physical activity counseling service if they have questions or they need support for their child's physical activity. I know Sick Kids does have a cardiac physical activity program. I'm not sure whether theirs is open to other diagnoses or not. But there's also people in the community that can help with those types of things. So that was the study that we did with the cardiac families. And so out of what they told us, we created what we call a toolkit of resources and to share information and help with that communication piece. And some of the resources are things that we just used that other organizations had developed, and some of the tools that were ones that we created ourselves based on what the families told us. So this is a resource from Statistics Canada, for instance. It's available on the Statistics Canada website, kind of a one-pager thing, and it just summarizes really the current knowledge about how active children are in Canada. And so if you look more closely at the graphics, you'll see that children aren't active. Only 1/3 of Canadian children are actually meeting the physical activity recommendations that I talked about earlier. So the majority of kids are not meeting those recommendations, are not active enough for optimal health. And so the corollary of that, I suppose, is that if your child is just as active as all of their friends, they're probably not meeting the guidelines. More likely that they're not meeting the recommended level of physical activity. We know that girls are less active than boys at all ages, and that activity levels decrease the older the kids get. So from 5 to 17, their activity levels just go down and down and down. There's also information on that handout about things that it says factors that increase physical activity in kids, but the research doesn't actually show this increases physical activity. It shows that it's associated with higher levels of activity, and that may be a subtle difference. But so parents who are more active, their kids are more active. If you put kids outside, they become more active. So you get 60 minutes outdoors gives you an extra 7 minutes of moderate to vigorous physical activity a day. And the key piece that we try and emphasize on this is that active lessons and leagues and team sports and all the things that we usually think about when we register kids for dance classes or soccer teams or hockey teams or whatever as being their physical activity, in most cases, a 60-minute session of those structured activities results in about 10 minutes of physical activity, not 60 minutes. So just to keep that in mind, and that goes for school phys ed classes as well. There's about 6 or 7 minutes of physical activity in a 1-hour school phys ed class. This is a second resource that we took from the Public Health Agency of Canada website, and it has tips to get active. And this one that I'm showing on the screen is for kids 5 to 11, but there's one for 11 to 17 years old. There's one for younger kids. There's one for adults and older adults as well on their website. But things like encouraging walking to school and getting active as a family, getting them to skateboard or bike or run instead of getting a ride if they're going somewhere nearby, asking them to help you walk the dog, having them rake leaves, carry groceries, shovel snow, encouraging them to dance to their favorite music, and then replacing computer screen time with something more active. And the other part of this resource, which I really like, is that it talks specifically about the health benefits for children of physical activity. As adults, we often think about, it decreases your risk of heart disease and high blood pressure and obesity and diabetes. And that's all true. If you have a physically active lifestyle, you're less likely to get all of those health complications as well as many types of cancer. But for children, there's physical activity health benefits that they get right away in childhood. It's not just about what's going to happen to them when they're 40 or 50 years old. So, and the primary one is socialization with their friends. So much of children's socialization and interactions with peers are based on physical activity. So if you think about recess or lunchtime at school, or the birthday parties they get invited to that are swimming parties or bowling parties or skating parties, or going to the playground and interacting with other kids at the playground when they're younger. Even teenagers often will interact with their friends. They might sit and chat, or they might go shopping at the mall, or the guys might hang out in a park or something. So often their physical activity is the basis of their social interactions and how they develop relationships with their peers. So it's really important from that perspective. It does obviously improve their fitness. There's also really good evidence that it improves their concentration and enhances their academic scores. So there's good research showing that kids who have trouble concentrating, if you actually put a stationary bike or a treadmill into the classroom and allow the child to go and walk or pedal the bike when they're having trouble concentrating, that they actually can concentrate better on the lesson and learn more effectively. And there's also research that shows replacing 1 hour of class time a day with an hour of moderate or vigorous physical activity actually improves children's grades in school, even though they're spending an hour less a day in the classroom. So there's lots of benefits from the academic side. Obviously, there's stronger hearts, bones, muscles, and all the things you think about. Improves self-esteem. It helps them to manage stress, which is a problem growing in importance among all ages of children over the last decade or so. And the other piece to remember is that physical activity is actually necessary for healthy growth and development. So many of the connections in our brain are made when our limbs are moving. If our limbs aren't moving, those connections don't get made. Our bones grow in response to weight bearing. So if you're not up and walking around, your legs won't grow. So if you've ever seen a child born with spina bifida who's never been able to walk, by the time they're teenagers, their legs are still really short because physical activity, they haven't been able to be active with their legs in order to get their bones to grow. So from a number of perspectives of physical and mental health, physical activity is really important for children. So those are a couple of examples of the resources that we stole from other places. And now I'll show you some of the ones that we developed specifically for kids with medical conditions. These are not yet available on the CHIO public website, but they will be. We have the English, they're doing some final edits to the English version, and then they have to be translated into French, and then they will be posted. So if you go to our website, probably end of April, when you go to the main CHIO, chio.on.ca, the main page, then there's this link at the top for parents with resources and support. So there's all kinds of resources that are available to parents and families about all kinds of topics. And to get to the resources and supports page, there's a healthy active living section. And that's where these next resources that I'm going to show you, if you want to get a hold of them and use them for yourself, that's where you'll be able to find them hopefully in a couple of weeks. So the first one is this outdoor time resource, and it has, again, some facts about getting kids outside to be more active. That they increase their physical activity when they're outside. But it also has some tips on how to dress for outdoor time. And I know there was a question about getting kids outside in the cold weather, cold Canadian winters. So there's some tips here about how to prepare for being outside, either in cold weather or wet weather. There's also information about what's called risky play, and risky play is not something that's dangerous. It's play that allows children to make decisions and learn to make decisions about managing risks. So it might be moving quickly, or it might be climbing on a climber so they're up high. It might be playing with tools. It might be playing with, going for a walk in the forest and not having somebody show you where to go, just going and potentially getting lost. But this kind of opportunity for kids actually helps to increase their safety, because they learn how to manage risks, and they build their resilience and self-esteem and learn their own capacities and develop their self-confidence. So when they're faced with situations, they're better prepared for it. The next resource that we put together is this one, which is Be Strong, Be Healthy, Be Active. And this is a resource. The graphic here says specifically kids born with heart defects, but that's changing. The one online will not say that. It'll be children in general should aim to do at least 60 minutes of physical activity per day. The front page has some tips, general physical activity tips, things like wearing sunscreen, both in the winter and the summer when you're outside, wearing a helmet, how to dress when you're outside, warming up, keeping hydrated, and using the talk test, or using your ability to talk to know when you're working too hard. But the backside of this is what we've had a lot of feedback from parents that they really like. And so there's two sections on the back with check boxes. And so this allows the healthcare provider, whether it's your nurse or your doctor or whoever, to simply check the boxes of the activities that are appropriate for your child. So if they're allowed any types of activities, they can check all three boxes. If they only want them to do light physical activities that don't usually make you breathe too hard, then they can just check this one box. But then it gives parents and families ideas about what falls into that. Instead of telling them what they can't do, we're telling them what they can do. So light activities might be cooperative games, ring around the rosy, golf, billiards, bowling, etc. Parents have told me that this is very, very helpful, particularly when they're trying to communicate with schools and teachers about their child's physical activity, if there are physical activity restrictions for the child. The bottom half of that same page also talks about physical activity that makes you use your muscles to push and pull. And again, there's vigorous, moderate, and static activities, suggestions about what you can do within that range, and check boxes for the healthcare professional to indicate what's appropriate for the child, and these may change throughout the course of their treatment journey or recovery. They can indicate whether they can play the activities competitively or just in house league or casually with friends. And there's a comment section if they need to put in more information. This is another one of the resources that we developed. Again, it says for cardiac arrhythmias, but it also may apply to kids who've had cancer, who have developed cardiomyopathy as a result of their chemotherapy, because they're often told to keep their heart rate within a certain range. And so the front page of this also has checkboxes about the types of activities that you're allowed to do, and the healthcare provider can put in the heart rate that they want the child to stay within. The back of the page has tips on how to measure your heart rate. You don't know how to do that, and tips on how, if you're involved in physical activity and you find your heart rate getting higher than it should be, things you can do to kind of slow it down a little bit. And then the last one that I'm going to show you tonight is kids who are restricted from body contact. So this may be because of medication that they're taking, that they're not able to have hard bumping into other kids or with equipment, or bumping into walls or whatever things that might happen during physical activity. Sometimes it's temporary after a surgery, while the bones are healing. There's contact restrictions. So again, the front of the page, it helps to explain to the child why there are restrictions in the type of activities that they're doing, and how to make good choices about activities, and how to include the child in physical activity if their friends are doing something that they're not allowed to do. And then again, on the other side of the page, there's checkboxes for the healthcare professional to indicate the types of activities, whether they can do just activities that really don't have any risk or have very little risk of impact, or whether they can do activities that don't typically have impact but might occasionally have impact, whether the restrictions apply to the whole body or just a part of the body, in fact, such as where they've had a limb amputation or something. The duration of the restrictions, so if they're recovering from a fracture, then it might be for 6 weeks. In some cases, it might be long-term. So those are the resources that are going to be up on the CHEO website that I hope families will find interesting. The bottom line of all this, at least from my research, is the most important thing is confidence. Parents and children need to be confident about the physical activities that are appropriate for the child. The healthcare professionals will always tell me that the parents bubble wrap the kids, but I have talked to so many families where the parents have tried everything under the sun to get their child to be active, and their child is the one who's like, nope, 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 I'm not going to do it. And so even if the parents know the importance of physical activity, the child also has to be confident. And I find most of the time when we're doing physical activity counseling with our families at CHEO, it's around this confidence piece usually, and the child's lack of confidence comes from one of a couple of different potential sources. Either they've had messages from other people that they shouldn't be physically active, and that might be the parents, but often it could be teachers, it could be daycare staff, it could be coaches in the community, it could be parents of their friends. They go for a sleepover and the parent of the other child, not their parent, is restricting their physical activity. So it's not necessarily the parents of the child. So the children who lack confidence have either had messaging from healthcare professionals or other people that about, physical activity not being appropriate or maybe dangerous or might be harmful, or the children themselves have associated physical activity with a lack of success. So they've either tried to keep up with their friends, and because of their health condition, they haven't been able to keep up. And that creates kind of a negative feedback loop where they don't want to try anymore because they can't keep up, and they don't feel good when they're not successful. And nobody wants them to pick them to be on their team because they can't keep up. And so that sort of scenario goes around and around in circles. So it's usually one of those two teams. I also can think of a 6-year-old who I was talking to about why he didn't want to be physically active, why he didn't want to play soccer. His dad desperately wanted him to play soccer. His dad was European background and had grown up playing soccer, and desperately wanted his son to play soccer. And his son was absolutely adamant that there was no way he was going to play soccer. And when I talked to the child about it, it was actually quite logical from his perspective. He told me that he had spent so much time in hospitals for his medical condition and going to doctor's appointments and stuff. And he really didn't like doing that all the time. And his friend played soccer and broke his leg and had to go to the hospital. So he wasn't going to play soccer because he didn't want to break his leg and have to go to the hospital yet another time. So it's amazing when you talk to kids, the things that can impact their confidence for participating with their friends or participating in physical activity. Building activity into daily life is really important. Habits from the youngest age are built up, and we know research shows that those habits get maintained over a lifetime. But also important because children do get unique health benefits, not just strength and fitness. So it doesn't necessarily have to be exercise the way we think of it as adults. It doesn't necessarily have to be sports, but building activity into your day. And so, parking the car a little bit further from the grocery store or the mall and having the child walk an extra 100 feet to and from the car can help to build in a little bit more physical activity. Or instead of having the young child in a stroller when you go for a walk, have them either on a riding toy that you can also push to help them, or a bike if they're old enough to ride a bike. And taking stairs instead of the elevator if you're only going up one floor, et cetera, all those little things add up. They may not seem like much, but they definitely add up, and they do provide health benefits. And then ask questions and ask for help. So as I said before, doctors and nurses and parents often get focused on tests and treatment and medications and stuff, and they don't necessarily think about physical activity. But make sure that if you are talking about it, that you get explanations that are realistic for your lifestyle, that make sense to you and make sense for what your family chooses to do and the resources that your family have. And ask for a referral to a trained physical activity professional if you think that's what you need. So that's it for my presentation. But I'm happy to answer questions. I don't know, Sarai, do you want me to specifically answer the questions that came in ahead first of all, or?
Well, let's just thank you first of all for the presentation. It's so interesting and informative. I'm just gonna stop sharing. I don't know if you can stop sharing. There we go. Thank you. Yeah, so we have a couple parents here. I just wanted to see if they have any questions first. If they feel free to type them in the chat, or just turn on your camera, or just speak if you have any questions for Dr. Longmuir about what she spoke about. maybe they're thinking about it. So that's really important piece about, we all know those benefits, great benefits of physical activity, but that motivation, right? Especially, even for adults, like we know it's healthy for us, but it's just the motivation, getting out. And there was a question here about a parent in advance who had asked, how do you motivate a child who just loves to be comfy at all times? The child is around 5 years old, and especially to play outside when she just wants to be inside where it's warm and comfy, or soft fuzzy blankets and teddy bears and toys. How do you motivate a child like that who really doesn't want to go outside and play, especially in the cold winter, to go and be more physically active?
Yeah, and it's hard without sort of knowing a lot about the family to make specific recommendations, but there's a few thoughts that I would share in response to that situation. First of all, the kids will be active if it's fun, right? As adults, some adults are active because they enjoy going to the gym, or they enjoy going for a run or whatever. But a lot of adults also will go to the gym because they know they have to, or they know that they're at risk for this or that or the other health thing. They don't necessarily always do it for fun. Kids are only active for fun, and that pretty much goes for teenagers too, until they get up to be sort of almost university or college age. Even in high school, and that's why activity levels go down in teenagers, is because the reason physical activity doesn't really go down in teenagers, they go apart. So there's a group of teenagers that are involved in sport and are the athletes, and their physical activity stays the same. And then there's the group of teenagers who aren't successful and aren't as skilled, so they don't find it fun, so they drop out and their activity goes down. And so the average overall goes down. But fun is really the key factor. Mm-hmm. So if the child is cold, I get cold really easily, and I wouldn't go outside if I was going to be cold either. But there's lots of things you can do inside in the winter. So I think, Michelle, you've shared some of the information about the research project we're doing. So we've got a website with over 1,200 activities on it, and I would say maybe 200 of them are outdoor winter activities, and everything else can be done inside. So for motivating that child, it's really about finding something that's fun for them. And it may mean, keeping them wrapped up in their comfy, warm blanket, holding them in your arms and dancing with them to some music. Eventually, if they like it, they'll probably start moving on their own, even though you're holding them, or they might want to be put down and dance with their blanket around them. And you can kind of progress it that way. There's lots of things you can do in the house, wrapped up in a blanket with the hokey pokey song, and moving one arm out at a time and different things. It's really about, especially at that age, it's about finding something that they like to do. Acting, in plays, doing little shows, or standing up and telling jokes and that kind of thing. So thinking out, not necessarily thinking about physical activity as the sports or the dance classes or the things that we typically think of, but trying to build it into different aspects of the day, having the child walk out to the car and climb up into their car seat without assistance, as opposed to being lifted in to those little pieces of physical activity can make a big difference. And if the child finds things that they enjoy, then you won't have a problem motivating them. But that's kind of where the individual counseling that we provide to families at CHEO comes into play, because sometimes it can be very hard to find what interests a particular child. And that's why when you sent me that question earlier, I asked you if you knew approximately how old the child was. Because what I was really asking in that was this, sort of a 2 or 3 year old, or was the child old enough to probably have had some experiences, some negative experiences that were prompting that behavior. So I think I think that child would be old enough that they've probably been cold when they've gone ice skating with the family, and all they remember is being really cold, you know, and they don't associate it with being fun. So that I think is kind of my suggestion for that. It's easier said than done in a lot of cases, because the more the kids have had negative experiences in the past, the harder it is to get them to refocus on what is enjoyable and what they like to do sometimes. But it's really kind of all about the fun part. I think the family in the question you sent me, the family had said they had tried using like fluffy lined leggings for the child to wear to keep them warm and stuff. And I think that kind of thing, they're definitely on the right track, even though they said that it didn't work. But I think that idea is on the right track, right? Because if the child likes to be cuddly and warm, then you want to find physical activities that the child can do while they're wrapped in their favorite blanket or while they're cuddly and warm in the house, so that you separate the idea of physical activity. I'm either cuddly and warm or I'm physically active. You want to make sure that the child doesn't make that distinction. And once they can be physically active and cuddly and warm at the same time, you know, they might be just drawing or painting or playing board games with you wrapped in their blanket, but eventually you might get them to play Twister on the floor and, still not wrapped in their blanket maybe, but wearing a nice big woolly sweater or something, and sort of make the transition kind of gradual that way, so that the two things, being cuddly and warm and being active, are not necessarily opposites, that the two things can happen together.
Those are great tips. Thank you very much. I do have a question here from one of the parents here tonight. They want to know, do you have any recommended top 3 sports for a child with cancer that they can play? Kind of sports.
Yeah. Do you have can you provide any more information on sort of what, is it a solid organ cancer or leukemia, blood cancer?
We'll wait to see if she types out.
So I'll just say, I don't necessarily recommend particular sports or not, and I don't not recommend particular sports. Again, it really, I do a lot of work with kids on what they find fun. Each child will have different things that they think are important in terms of making it rhabdomyosarcoma. Thank you. Each child will have different things, ways of defining what's fun. So for some kids, they want to be with their friends and it doesn't really matter what they do. For other kids, they want to be outside and they don't care if they're with their friends or they're by themselves. They just want to be outside. So it really kind of depends on what they would be motivated, what they would be motivated to do. Sorry, I'm having trouble talking at the moment. But in terms of your particular diagnosis, I guess it partly depends on the treatment and sort of their level of function. But if they've been lucky enough to get away with basically their function unaffected over the long term, then enrolling them in physical activities that they want to do with their friends which in Canada is usually soccer in the summer, or maybe baseball or t-ball in the summer and hockey in the winter, can be a good option. But there's also lots of other options for kids whose function has been affected. For instance, there's sled hockey. So for kids who don't have the leg strength or the lower body control to be able to skate, they can play hockey in a sled on the ice. Similarly, if they're having trouble with function like running and stuff, often t-ball or softball, they can hit and catch and have a substitute runner run for them, depending on, if you talk to the coaches or talk to the leagues. There's also lots of other sports that are very adaptable. So many of the martial arts are very adaptable. Tai Chi is the easiest in terms of there isn't any sort of physical contact as part of Tai Chi. But many karate instructors, for instance, will karate classes for younger kids don't involve a lot of body contact anyways, or even if they do, then they can modify it to reduce the risk if the kids have particular activity restrictions. So, and martial arts are very popular with a lot of kids, both boys and girls, as a sport. Swimming is a great sport if they're more on the individual sport side, not so much team related sport type of stuff. But there's also there's things like competitive chess and cup stacking and all kinds of things that are competitive team sports that don't actually involve a lot of physicality. That doesn't necessarily meet the physical activity guidelines, but it gets them the opportunity to be on a team, to be competitive, to be able to be successful, all of the things that come with being in sport, and not necessarily the physically active part of it. But there are lots of adaptations. If there has been amputations and stuff, the War Amps is spectacular at providing whatever sport adaptation equipment kids need. I don't know, that's a few ideas off the top of my head.
Those are great ideas, and the fact that a lot of sports can be adapted and there's always other organizations and resources if that's something your child would need. I think pretty much any sport nowadays can be adapted to include all abilities. So that's great. And you had mentioned martial arts. I just posted today, we know another organization, it's called Kids Kicking Cancer, and they provide free therapeutic martial arts lessons for kids with cancer or pain in general, and their siblings. And there's a program in Ottawa, there's one in Toronto, Windsor, and London. So that's another resource if that's something your child is interested in. Atrina, martial arts, Kids Kicking Cancer is called. So yeah, thank you so much.
Another one that people often don't know about is curling. It's a sport at the Paralympic level. So you don't necessarily have to be able to stand and sweep. And they have what's called Little Rocks. So that's a separate program for kids to usually from about 5 or 6 years of age. They can get involved in curling, and particularly I have a lot of kids with very complex conditions who really enjoy curling because they learn the sort of the I don't really call it the techniques and the strategies of the game, and then as the captain of the team, you don't actually do the sweeping, you deliver the rocks, but you spend the rest of the time telling your teammates where they need to aim and stuff. So for kids who don't have the same physical capacity, they can actually be the leader of the curling team. from that perspective, which is something they often don't get to do in a sport. So that's a winter option that I often find is really helpful. But there's lots of things you can do in the community too, frisbee golf and different things that are sports. They're maybe not organized team sports, but there's competitions for frisbee golf too. So there's a few ideas.
For sure. Thank you. And I just want to mention, you said that you have a website or where there was hundreds of listed activities. Is that going to be on the CHIA website? Is that what you mean?
That's the research project. So the information that you have about the research project.
If you can just briefly mention the research project and how people can get involved if they're interested in participating in your research project.
The best way to get involved is to connect with me. Or I think you have our social media post, which has a QR code on it. But basically what the research is we've developed a website that has over 1,200 different physical activity ideas and lessons, or not lessons, but instructions for all these different games and sports, everything from learning to put your face in the water and blow bubbles, to doing tricks on your BMX bike, to improving your soccer skills, or whatever, winter, summer, other sport-based backyard games, things you can do with your friends, what have you. And you can find a lot of databases like that with activity ideas on the internet if you Google. The difference with ours is that in the back end, we have each activity is coded so that if your child does have physical activity restrictions, we can code that into their access to the website, so that when they're searching on the database, if they're not allowed to do body contact activities, for instance, then none of the body contact activities that are in the database will show up when they search, because that'll be blocked from their account. And so it gives parents a little bit more comfort in terms of their kids aren't going to find something that's inappropriate for them from a health perspective. So the research project we're doing right now is we've created this website, but we're looking for families who want to try it out and give us feedback and tell us whether it actually helps them or not. So you get free access to the website for a month, and then we ask you to do about a 20-minute interview to give us some feedback. And if you do that, you get permanent access to the website to use whenever you want for activity ideas. And you can search different ages and different sports and outdoors and indoors and things with music and whatever, all different kind of categories to find different things to do. So
great. We'll keep promoting that. You're still looking for participants, so we'll be sure to keep posting and promoting about your study as well. So yeah, great. Thank you so much for coming in tonight and speaking about all this important information that people sometimes, like you mentioned, don't think about, asking their healthcare professional about physical activity and how important it is for their kids. So thank you, Dr. Longmuir. Have a good evening. Thank you for joining us tonight, everyone. And we'll have this recording up to share with our families tomorrow, and to keep promoting your study as well. So thank you for all these amazing resources.
Thanks, no problem. Have a good evening, everyone.
Good night, everyone.
Night.